laser in general is light. It is very specific, very detailed, focused light, and each laser would do a different function in the skin. Fractional CO2 laser treatment is one of those lasers. It consists of very focused, specific beams of light that are emitted from that machine, and that when they are aimed at the skin, they create coagulation of the skin in micro beams. So they will create like micro wounds in the skin, and those wounds I can also adjust the depth of, the width of, by varying settings on the machine. And by creating these micro wounds, they have coagulated the skin, the old skin will be coagulated, and the skin will rush to heal itself. And by healing these micro wounds, it will create newer collagen and tighter skin, and thereby improving texture, wrinkles, scars, different kinds of scars, even sun damage and pigmentation. That specific CO2 laser is absorbed by water in the skin. There are other lasers that are absorbed by different targets. Most important thing before doing a CO2 laser treatment is the assessment. So patients don't come in, don't call for a CO2 and come in. A very detailed assessment of their skin during the first consultation is important for me to determine if their skin or their condition is suitable for fractional CO2. Afterwards, there will be probably pre-treatment of the skin. So if they have some pigmentation, it has to be treated. And the skin, I might prescribe some creams to prepare the skin for the treatment. And then the most important thing is before the treatment to set a suitable time in their calendar, because it involves some downtime, which I will discuss later. Afterwards, when their skin is ready, patients usually come for a test patch to see how their skin heals. And then on the day of the treatment, a numbing cream is applied all over the skin for about 30 to 40 minutes, which would really give a very good anesthesia. And then their eyes are covered, and I would do the treatment on the specific areas. While we're doing the treatment, there's usually a jet of cool air that is directed at the skin to cool it down. After the treatment, we would still continue to cool the skin down, apply some wet gauze, and apply the specific ointment. And the patients leave with clear instructions how to take care of it, as well as all the necessary creams. After the CO2 laser treatment, immediately the same day, there will be a bit of swelling and probable crusting in the skin. That continues into the next day, where the skin is a bit red, maybe a bit itchy and oozy or scabby. From the third day onwards, those scabs turn darker, so the skin turns dark and rough, where the laser had been used. And that process for these scabs, these dark scabs, to peel off would take about 6 to 7 days, so a week after the treatment. Patients are given very clear instructions on how to take care of the skin after the treatment. Specifically, they need to strictly stay out of the sun, strictly stay indoors for at least 1 week, and hence they need to really plan this treatment. They need to use the creams provided. Sometimes I might prescribe some tablets to prevent viral infection. They need to clean their skin well, and after the 7th day, the skin usually goes back to normal with a bit of redness, but these scabs would fall off. CO2 laser treatment is the best and the strongest treatment modality, and as far as lasers are concerned, for treating scars. So it gives the best results compared to the other non-ablative lasers. So CO2 laser treatment is an ablative laser treatment, meaning it creates wounds in the skins, and hence the results are better compared to other laser treatments. But during the initial assessment, I assess the scars in detail, and if they need a pre-treatment with subcision before the CO2, I do advise the patient to do it, because if the scars are indented and pulled down by fibrous strands, I perform that subcision procedure to lift the skin, and then the results would be even better than doing the laser directly. And of course, pre-treating the skin, if there's pigmentation, will give better results. So yes, fractional CO2 laser can be performed on all parts of the body, so face as well as trunk and limbs can be treated with this modality. Procedure, especially procedures that compromise the integrity of the skin, do carry complications, but these complications can be reduced to a minimum if the pre-treatment is done, if patients follow strictly the guidelines of how to take care of their skin, how to clean it, and avoid the sun. The complications are minimized dramatically, but there are complications including mostly pigmentation, so what we call post-inflammatory pigmentation. Infection is extremely rare, again, like I said, if they follow the guidelines, but it's always a possibility. And prolonged redness is one complication as well. So the skin after CO2 laser treatment might continue to be red for a month or a bit or more after the treatment, but that is not something we really worry about, because eventually it goes back to normal.